So we try to incorporate this slide or the recent version in each of our talks. And this is a picture of our patients from one of our support group meetings. We take them on the boats, or it's the Gateway Clipper. It cruises the rivers of Pittsburgh. And so buongiorno from Pittsburgh. And these patients each sign a consent. And if they want to be in the picture, they can be in the picture. If they don't want to, they can stay aside. They have a little red dot on their name tag. But they are so excited to be able to get their story out and around the world. So I like to start with this because I think this is the thing that sometimes they get lost and they get forgotten about. And this is the reason why we all do what we do. What I'd like to talk to you about is one of our patient-driven programs. It's the Dan and Joan Barron Pennsylvania IPF Registry. This was developed in 2007. One of our patients' husbands was a lobbyist in Pennsylvania, and he was very upset that when he went to the literature that he couldn't find much information. The same thing, cystic fibrosis versus pulmonary fibrosis. So he lobbied heavily in Pennsylvania to develop this registry, and it's a cohort of 5 centers, and these are the 5 academic centers in Pennsylvania. And if you take a look at this one of our daughters of one of our physicians drew this. So this is the state map of Pennsylvania. This is the University of Pittsburgh. We're the coordinating center. This is Penn State Hershey. This is Geisinger Health System, which has branches throughout Northeast Pennsylvania, University of Pennsylvania, and Temple University. So the 5 centers work together, and this registry is open to anyone in Pennsylvania who has the diagnosis of pulmonary fibrosis, as well as the contiguous states. So New York is north of us, West Virginia is southeast, Ohio, Maryland, Delaware, and New Jersey. So patients can also join our registry. The aims are as here, but the biggest is we want to get more patients to centers of excellence for IPF. And there's 2, not only for care and for transplant evaluation, if that's a consideration, but also for participation in research studies. So this is the lobbyist who fueled this effort, Dan Barron, and his wife and his sister-in-law both died from IPF. So how do patients register? So there's 2 ways to register. They can go online. We just tell them if they don't have we have cards that we give out, but to Google PA-IPF registry and you can get to it. Now we realize that many patients in this population may not be computer savvy, so we have a 1-800 number also that patients can call into. They get to speak to a research coordinator and she invites them to participate. As a result of participating, they receive a newsletter, and the newsletter is generated quarterly, and it tells stories from each of the 5 centers, and we invite our patients to write stories for this. And then we also advertise what events are going on around the state, support group schedules, advocacy events. And one particular story that I'd like to share is one of our patients traveled to Hawaii with oxygen. So he told his story in the newsletter of how he made it from Pittsburgh with the multiple flights to get to Hawaii. And what ended up happening is that inspired other patients to know that they could travel. And we had a patient who came back and said that after she read that, she scheduled a family reunion where they went on a boat cruise. So the newsletter reaches many patients. So our current registry enrollment today, it started back in, as I mentioned, 2007, and this is at the Simmons Center. Over the years, we have 461 patients that participate in this registry. Temple has 150, Geisinger has 55, the University of Pennsylvania has 100, Penn State has 59, and our total number before I came here is 825. Now, these patients as I mentioned, they could live in Pennsylvania, they could live in the contiguous states. If you live in a contiguous state, so if you're a physician or you're from one of our states that surround Pennsylvania, what we ask is that you can tell your patient about this, and they don't have to come to one of our centers to get care, they just need to be connected, and then as a result, they'll get the newsletter. So advocacy and awareness, Dan mentioned, we've had a few advocacy events, and if you're wondering how can you reach your patients, how do you get them to know about IPF, pulmonary fibrosis, these events are amazing in the draw of people who come in. Back in 2004, the Coalition for Pulmonary Fibrosis held one at our hospital, and we had 180 attendees come. Then in 2009, and then again in 2011, we actually held our own through the PA-IPF registry, and we held it in Harrisburg. And we had over 100 participants the first time, and then we had over 200 last year. And what we did at that 2009 event is we had a map of Pennsylvania, and we had push pins. And when the patient came in the door, we asked them when they registered to put their push pin on their hometown where they came from. The next day, we had a visit to Capitol Hill with our legislators, and we carried that map with us. And it was actually, it was amazing, disappointing. There were many feelings after meeting with legislators, but the take-home, the most important take-home was that our chair of health and sciences in Pennsylvania was from a rural area, and he said, how come there's no one from my area that came to this event? And we said, well, it's awareness. We need to be able to reach more people. We need to have more funding to be able to reach. So, interesting story. This is a picture from that day, us with that map, and us meeting with the legislators. So we have another great group of people who help to advocate for IPF awareness, and these are our daughters. And these daughters, it's amazing, like Daddy's Little Girl is like, that's a great group to go after. Actually, you don't even have to go after them. They come to you because they want to do something in honor of their father, and now it's extended to other family members. But they also help to advocate for IPF awareness. We have a yearly golf outing inspired by one of our patients. We have a daughter who's an artist. She drew these, created these t-shirts. And these daughters also participate in our IPF awareness events. They go to Capitol Hill in DC to lobby. And also they're very influential in raising money to help support patient events, which go back to supporting patient education and research. So I work with these wonderful ladies in Pittsburgh. These are our staff. And I told them that I would bring them to Italy with me. So they donned the t-shirts. And here they are, and they were very excited. And when you take a look at, there's 3 different designs of this t-shirt. There's a message on the front, and there's a message on the back. And this was, again, inspired by one of our daughters. And then I have one more slide. This past summer, another daughter, actually last summer, started an IPF walk in the North Shore of Pittsburgh. Last year we had, she had 200 people come, and this year there were over 400 people. So it's getting that message out. So engaging these care partners with our patients have actually been very important for us. So thank you.
Thank you, Kate. That was very helpful.